I'm Sherry Ahirirwe, a research scientist at the Center for Rapid Evidence Synthesis, and I'm part of the team that is working on using an evidence gap map to inform the National Health Research Agenda. So the Ministry of Health is revising the National Health Research Agenda and reached out to ACRES to support this process, which is contributing to the formulation of the National Research Agenda using an evidence gap map. So this work was started in 2022, and we began by formulating a steering committee to support the work. So this involves members from the Uganda National Health Research Organization, members from the Ministry of Health, and academia as well. So the steering committee is guiding the development of the research agenda, and which is going to take 5 phases, and we are now in the 3rd phase. So we started with the planning phase, where we developed the protocol for the evidence gap map, and then we completed the 2nd phase, which is the situation analysis or the document analysis, reviewing all health research conducted in Uganda between January 2010 to June 2022 at the time. So we searched the evidence from both published and unpublished sources, and all this data was systematically reviewed in terms of title and abstract, full text screening, data extraction, and now we have a map. The map has over 7,000 studies included, which represents all the health research that has been conducted in Uganda between January 2010 to June 2022. So now that we have the map complete, we are now in the phase of the priority setting exercise. What we know is that previously, the previous research agendas that were developed did not really rely on an evidence base. So what the evidence gap map does is that it will be one of the guiding elements that the stakeholders will use in the priority setting exercise in order to come up with a list of the top priorities for research in Uganda to guide the research landscape. And we hope that this work will benefit both the Ministry of Health as well as other stakeholders in academia and donors. So the team has now reached out to over 500 stakeholders to help us in a qualitative survey to list. These stakeholders are in academia, in the Ministry of Health, as well as NGOs or funders in the health sector. So we expect that these will send out a list of the current priorities that they see, or priority areas that they think we should focus on, the agenda should focus on. So once we have this list of priorities from this qualitative survey, it's a wider group of stakeholders, about 500 people. Once we have this list of priorities, we are then going to analyze the free text in Deduce software to identify themes. And then after we've completed identifying these themes, we'll invite a smaller group of stakeholders for a physical meeting through which they will now identify the top 30 priorities, and from that we'll then hold a training session to teach the stakeholders on how to use the evidence gap map. So once they learn how to use the evidence gap map, they will now be able to utilize the map to help inform their decision on selecting the top 10 to top 20 priorities that will then form the the final research agenda that we shall roll out, and we hope to roll this out soon, by the end of this year, and have it out to the different stakeholders, both the evidence gap map as well as the research agenda. Thank you.